what you have said is right. In fact, let me give you some figure. We have about 60,000 doctors who are registered with Delhi Medical Council. And I was asking, we are in the Maulana Azad Medical College, which is at the watershed area between New Delhi and Old Delhi. We cater to a whole lot of Old Delhi population. And some of you would remember that all the famous practitioners have been in Old Delhi, Daryaganj and that area. Not a single MBBS doctor has gone into practice for a long time in that area. And that's true for the whole Delhi also. They are not there. You are right. Why are they not there? If there is a MBBS doctor and there is a problem of chest pain, how many of you will go to him? Not a single one. What have we done? I am a cardiologist. I'll say, don't go to that MBBS doctor. That fellow knows nothing. He can do nothing. He'll just waste your time. You will die. The dignity and respect of a basic doctor has been brought down in our society, not by the society themselves, but by the medical profession, by the regulations, and by these persons who have a vested interest, maybe those providers of the devices and the drugs. So you have a point there, but how much will we take it further is my concern. My concern is not to go to a cardiologist. As I said, we are going beyond the cardiology and beyond the gastroenterology into specializations which nobody else has them in their own country. Yes, sir. So can we take them there? I want to make some notes when you ask me.
No, I have a different situation. Can I have the mic, please? My name is Arun Birmani. I'm an architect, and there's a great architect who said less is more. Same
The more the merrier, we said.
Huh?
We said the more the merrier.
From the American but less is more. I can quote the architect, Mies van der Rohe, German architect, 1886. I was also in a situation 20 years ago when I attended, again a German person who was here, and he was to show the exhibition at, what's that called? Buddha Janti Park. So I said, I'm very happy. Nobody else was there, only I was there, I hadn't right. Now today we have only Dr. Naresh Gupta. So I would suggest, since I'm little, that we should let our hair down. You have a lot of thinking, and one is always constrained for time. That I should be able to ask a question, this is very intelligent, there are so many speakers, and you also go by hierarchy. If Dr. So-and-so is there, Dr. Chaudhary is there, first he is called, and then, so anybody can ask any question today. I'm not going to ask anything, I'm just setting this thing. So you don't feel guilty, the madam, that other people have not come apologetic or not. Sorry, I'm use a very strong word. So everything is for the good. So today you can also come out with whatever is in your heart. And we are also coming to the close of this series, which is next to me. So I hope I am understood. So I'm not going to speak anything more. Less is more. Today we have lesser number of people. That is only we have one person, which is a doctor. So we have more of it. No. I mean as a doctor. So I'm just stopping. Anybody can ask anything. So you are also free to spend more time in whatever theories you have, etc. etc. Now, for example, now I understand when you have more specializations, that means every specialist will do his work and he says, I don't know next to this thing. That also means that there is less accountability that happens. Like you said, left ear or right ear. Many years ago, maybe 20 years ago, I had some problems. I went to this person, he would just treat me like this. I asked that person, I want a person who is sympathetic. And fortunately, maybe I found the right person who was sympathetic, and yes, that's the best person. As an architect, who is the best architect? Not who is really very high-fi, who understands you, accommodates you, and quite often you need a sounding board. You probably don't even need that thing. So very often, even as a patient and doctor, you need a sounding board. You think that this is the problem with me, this is what I can do. And you will say yes or no or something. Thank you very much. So let's keep the...
ऊपर की कोई प्रॉब्लम है तो मुझसे बात उसके नीचे जो प्रॉब्लम है none of my headache to another doctor for that. So he didn't realize that whatever problem I had was a result of the medicines which he had prescribed. So that's what sometimes happens.
Okay, I think Dr. Sareen has arrived at the right time. Dr. Sareen, many of you, I don't think anybody would not recognize you. All of you would recognize him. He is a stalwart in his field. He is a gastroenterologist. But I think more than that, he looks at the body as a whole. And he not only looks at the body of an individual, he looks at the health of an individual. Right now, he is the director of the ILBS Center. He has also been given the mandate of running the Medical Council of India through the bad times. And in fact, the good that he did that time is coming out even till today. That's the only good I can remember. And I thank him for having made it. We have just concluded and introduced the subject of this, specialist, super specialist, how it affects the individual and how it impacts the nation. So we were just going to open the discussion. Before that, we would like you to make some statement.
And partly the traffic was there, but partly by mistake. I just want to show you a few slides if that is there. I think Dr. Naresh has shown you some, but I'd like to show you some which will affect your children, not you. So it is important, and that's where the specialist role may come in. Neurology, neurosurgery. There was a good doctors.
King George Lucknow.
King George Lucknow. So when he would sit in a small clinic, all the kinds of people would come, and when they would see me, although I was an MD, they would look at me as लड़का है इसके पास मत जाओ ये कुछ पता नहीं क्या कर देगा. So those days, guy with a grey hair, guy with a good heart and a healing touch, and this is true of today also, a good doctor, and he knew everything.